Good afternoon, and welcome to the City Club of Cleveland's Youth Forum Council, where we are devoted to conversations of consequence that help democracy thrive. I'm Vikram Sundaram, a junior at Solon High School and a member of the Youth Forum Council. It's April 28th, and you're watching a virtual youth forum. I'm happy to introduce today's forum, a conversation regarding healthcare disparities in Cleveland, which have been particularly pronounced in the last 2 years. As part of his political campaign, President Joe Biden laid out the groundwork for significant leaps and change in healthcare. President Biden issued nearly 40 executive orders during his first 100 days in office, about 12 of which were specifically targeted to address changes in healthcare. Some orders made way for easier access to Medicaid and the Affordable Care Act, while others directed secretaries of various governmental agencies to review policies currently in place, with some being rewritten or purged altogether. While a step in the right direction, those seeking healthcare reform believe tackling such issues should be more aggressive. Locally, and despite being home to some of the best healthcare facilities in the world, Ohio ranks 47th out of 50 states for healthcare. Ohio's ranking is largely the result of socioeconomic inequalities, such as access to healthcare, childhood adversity and trauma, and access to healthcare, among other issues as well. Also, several cities around the United States, including Cleveland, have declared racism to be a public health crisis. But what do these proclamations mean on the state, regional, and local levels? Joining us today to discuss these issues and more are Dr. Eric Scheré, PhD of Indiana University, and Heather A. Stroll, Vice President of External Staff Affairs at the Sister of Charity Health System. As in every City Club forum, you can participate with your questions. Text them to 330-541-5794. That's 330-541-5794. You can also tweet them at City Club Youth. We'll try to work them in. Here to guide our discussion is Youth Forum Council member Zoe Ellenbogen, a junior at Shaker Heights High School. Zoe, I turn the forum over to you.
Thank you. All right. Well, thank you for that amazing introduction. As he mentioned, he talked about Ohio specifically. So I thought to start this off, maybe you could talk about some kind of unique challenges that are specific to Ohio, Cleveland, just that general area. Either one of you can take this question.
Eric, I'm happy to start, and if you would like to join, I'm impressed. I'm glad that the Health Policy Institute of Ohio was mentioned as part of the introduction, as it really is a great source of information around how is Ohio ranking in health value, and they just released the 2021 report. In As it was mentioned, we are 47th in the nation. And so why did we get there? I think we have to look at some really important aspects. Equity. How are Ohioans experiencing poorer outcomes and living shorter lives because of policies, systems, and beliefs that discriminate against and unfairly limit access? How are we investing in the public health infrastructure and prevention? And how are we addressing childhood adversity and trauma? We know that more than 4 in 10 Ohio children have experienced trauma and adversity. And so we must do better to really go upstream and address the health disparities impacting Ohioans.
Dr. Scheré, if you want to chime in here.
Yeah, I think like Heather said, it's really important. I think you can make monetary allocation for access, but I think access is not the only way to address healthcare issues, because when you give people access to have medical services, be it hospital and staff, they don't live there, they don't stay there. But I think the structural conditions, the social processes, and the factors that affect everyday experiences of people, I think if you're not doing so much in that respect from preventive standpoint, and you give access in a context where healthcare is a corporate, $1 billion corporate industry, you are actually still distributing money indirectly to a lot more people, but you're not focusing so much about addressing the inequity issues that is affecting so many people in there. And then the other thing is that is also important, that um, if we're going to be able to, Ohio in particular, I think, in as much as it is really up on the radar, I think it's similar across this country in many respects. And part of it, is the issue about not just passing laws. These are structures that are centuries years old. And so how they came to be the way that they are important and beyond just law. And how those processes have evolved have also be laws interactions with different practices, socialization, teaching, and all kinds of stuff that have over the years converge to produce the kinds of the in disparities in healthcare that we see. So if you pass law and there's nothing that is done into the communities, the localities, like when we think about how certain people are segregated into areas where they have limited access to even water, just running water, where they live in communities that are not safe. They can't even get a chance to go and have a green space or have a walking space because the neighborhood is dangerous, and they are kept in home. Such people, even hospitals or doctors, prescribe certain health recommendations, like just mere exercise. They can do it. So if you invest in the access area where we pay for the providers, but don't do anything to the factors that are important in determining when people can get sick and when they're sick, whether they can recover quickly or they can die early, I think those are some of the important pieces that the law need to expand into.
Heather, if you want to follow up on that.
Well, I just want to applaud the Youth Council. We talk about health disparities, and we forget that really youth play a critical role in informing policy and really thinking about how can we do better as healthcare providers, as systems of healthcare. And I just encourage everyone to get engaged, because everything that the doctor talked about, you can help influence and you can get engaged to talk about. There's a lot of research that have suggested that if youth get engaged in health policy and health reform conversations, it has a direct influence on improving health outcomes.
Well, thank you. I guess I will say thank you for the Youth City Club. So going on, as we kind of all know, there's been a virus going on. So it was mentioned earlier in the introduction what kind of both of your roles were. Do you want to talk about how COVID has kind of obviously had some impact, whether negative or positive, on your work? Either of you can take this.
I think you can go if you
Me,
want.
You well, I'm going to talk about it from a community perspective versus a provider's perspective. We know that the more we can get vaccinated, the better we are as a community, and it has been a challenge to get everyone vaccinated, especially in underserved communities and in minority communities. We are seeing lower vaccination rates. Where Sisters of Charity is located, we're in the central neighborhood of the city of Cleveland. We've had some of the lowest vaccination rates. And for me, it's about trust and building trust with community. And you're seeing the direct impact of a lack of trust in getting folks vaccinated. And from my perspective, we can advise folks as much as we want about what we want people to do, but we need true engagement and trust to be able to have a healthier community.
Yeah, I think it's important, the trust piece, and I think, like, one of the pieces that we see yes, the COVID has really impacted life in so many ways, but we also know that the impact in terms of its um, morbidity, mortality, and even the economic and psychological impact of the mitigation measures have also been disproportionately um, on different groups of people, immigrant, racial minorities, the elderly, those experiencing homelessness, and um, those who are working in other areas like restaurants or other small scale businesses. And so you're looking at that, and so then you look at, again, it comes back to how as a society our structures have been created in such a way that they unevenly distribute benefit and burden, in such a way that it maintain a hierarchy, and I think that's important piece. And so because of that, has also become very difficult. I think it's one of the reasons why you see um, lack of trust in this process, because I think when we know in a system where historically, in order to sustain the hierarchy and how informations have been distributed that are also even unevenly been done. And so then it comes down to the question of, by the time I get this information and by the time I get this access, is it really about my benefit, or is it even about to still perpetuate the same um, inequities that we've been thinking about? And then, I mean, that we have experienced. Then you also think about even the processes by which say, even when vaccine became available, the processes by which the vaccine were administered. I think one, granted, we are doing this and we're trying to build trust. Sometimes instead of going through some of the protocols, sometimes we could have flipped it. Like for instance, before you have to make an appointment, provide your information and stuff before you get vaccinated. Why not sometimes like after getting people vaccinated, then you take all those information that you need to get from them? Because sometimes once you're making the appointment and people are making that, that's where that also can generate some of the mistrust, because it's like, okay, once I give you my information, this is my race, this is my background, how am I sure something else is not going to happen in the process of that? Because you already know, as I'm coming in, this is the person who is coming, this is the person who is coming. And so if we can reduce, in as much as we want to address the issues, I think we need to think about how to ensure that we decolonize the way we do some of these things so that we don't maintain the pattern that we have seen. Because the historical trends that we have seen, even though they are history, but they are still repeating themselves. And so most of the mistrust are justifiable in a lot of ways, but our goal is how do we earn credibility? And if we're going to do that, then we don't have to maintain the way things have been historically. Then I think on top of the pandemic, you are also seeing all of the kinds of the brutalities and in the police killings and all of those pieces, happening. So you are looking at this and then you are seeing that it's honestly, yes, the pandemic is a global issue, but I think what was more deadly and violence is the inbuilt features of our society, both even in our knowledge system and how we deliver services and how we treat people. I think the pandemic, for a long time, we know this, but I think many people seem not to care or were in denial. And some who also knew it, I think, was silent. But I think the pandemic really casts a more spotlight on the structural inequities that are even more deadly than even the pandemic, because sometimes some people had no choice. The choice of even staying home was even more deadly than being exposed to the pandemic. And one of the things that earlier on the pandemic showed, if right in the heydays of the pandemic, you will go to just mere grocery supermarket and you will see toilet papers were um, out. Most areas you get there and you see the shelves were empty. Why? A lot of people who had more resources at the time could buy them in bulk. And by the time those who were maybe getting a weekly check, who couldn't even buy them in bulks, got there, they didn't have anything to buy, and then, at that time we were thinking about the fact that your the higher your exposure to it actually increase the risk. So imagine I am living in the same community with you, and then you had the means to buy all the tea roll in the same supermarket that we all go. Then I got there, I didn't have, so I had to go to the nearest place that I got. And the more I exposed myself to areas that were likely to be infected, then I got my tea roll. But I came back to the same community, and guess what? The next day, the virus, is spreading in that same community. But if those bulk purchases were curtailed a little bit, that would not have happened. And I saw at some point most supermarket and grocery stores began to notice that. So now you go there, then they'll have limit. You have, how much that you can buy. And I think that also shows us that we can make some changes. Things don't have to be the way that they are. So I think in both negative and positive way, it has brought us to understand a whole lot of things. But then the question comes down to, are we going to learn from the lessons, or we're just going to just let things be with just our mere statements?
I think those were a lot of really great points, and I definitely agree with you that the stockpiling that occurred during the earlier parts of the pandemic was just problematic in so many different ways. I guess a very similar question I have for you both, and you also touched on this a little bit with the police brutality, along with COVID, with the administration change. Would you say you've noticed especially because you both kind of talked about this aspect of trust with the vaccine, would you say you've noticed an improvement or lack of improvement under Biden's administration versus the prior? And this is really, again, either of you, does not matter.
Um, I think in some respect, I think when it comes to, I think when the Biden administration got in some of the earlier, passed the executive orders and the policy wise, I think a lot. But I think one of the things that we have to understand that this is beyond just a mere one political party or an action of a president or just I think a momentary issue. And you could see even um, because of the pandemic, we got all kinds of statements from almost every profession. The American Medical Association, the American Psychiatric Association, social work universities, and all kinds of things made statement acknowledging, well, we got a systemic problem here. And that all of those things were done. I think the question is, now we are 2 years here into the pandemic. Um, what are we still seeing? I think that's where some of the questions are. And we have also now created a whole lot about diversity and equity inclusion positions almost everywhere. For me, I think the question is that we live in a society that is structured to maintain the white social contract, but we have not done much to what do we do with this contract, you know, and this contract flows in how we do things in our universities, our practices, our approaches. And I think as a society, to be honest, we are culturally traumatized by structural racism, but and oftentimes the narrative have been, oh, let's go to communities of color and help them, listen to them, save them. But here's the case where if I am trapped in the very thing that gives me the lenses with which I look at things, and I am not liberated from it, how much help can I give to people only than to make myself as a savior to them, which still diminish the very things around empowerment? And so the degree to which we dissenter white racial framing that make us to see everything in that lens and misrecognize all other things that does not come in that shape, and how our institutions, organizations, and procedures are built around these kinds of the same framing. So until we begin to recognize that and know that there are multiple ways we can approach some of these issues that we are talking about, I think the policies and everything they do, but in terms of the long-term effect, um, I'm not convinced at this point.
No, I think that's definitely a very good point about kind of just how the white saviorism mindset just infects, if you will, every little aspect. Heather, if you want to add or for follow up on that.
Well, it's really hard to follow up after him. Really, I would say again, I'm not going to repeat everything you said. It was just wonderful. I guess it's a call to action to this group, right? We saw social isolation, we saw trauma, both from COVID, from the terrible incidents that happened the last 2 years, and but you all can make change, right? You all could learn from this experience. What did we find in the healthcare environment? People wanted to be seen by people like that looked like themselves, right? So I encourage everybody to think about all that we've experienced and say, how do you think about career paths that might help to open new doors and look at fresh perspectives? How do we improve social connections and and build relationships with different communities and people who are not like us, right? And so and how do we elevate public health in some of those what I call more systemic ways that we create community change? Don't go downstream, go upstream. Try to really try to help make this world a better place, because you have the power. You're the next generation. So it's my message will really be a call to action to you to learn from this and help us be better.
I think that's very meaningful. I guess my question following that conversation would be, so you both touched on why there's this lack of trust and how these kind of band-aid solutions, to use another medical analogy, aren't really working. In terms of looking to the future with healthcare reforms, like where do you hope to see the US shift towards within the next 5, 10, 30 years?
Well, I have strong opinions about that, but I don't have to go first. Eric, if you'd like to go, feel free. I feel like I talk too much.
Well, I think, and I think this is where I think the youth also come in here, because I think for the most part, too, our health approach has been from a deficit approach and biological, I mean, determinist base that narrow what health is. I think health is beyond, you know, um, um, only biological issues and stuff. The environmental conditions are so important. Um, when you look at even some of the things that have brought a lot of medical innovations, or really, they didn't come from laboratory. They came from the experiences that people were living, like in the context where people were living in slave-like conditions with limited ventilation, no hygienic conditions, and very, I think, oppressive contexts that allow us to see, oh, if people are in this context, these are what happens, and these are what it does. So I think epidemiologically, we have seen and we know historically experiences from prisons, experiences from veterans, experiences from those in conditions that are not hospitable, and like what we've seen even in the pandemic. I mean, what pandemic the pandemic has shown us have shown. We've seen that public health is broader than just biological issues. And we need to, I think, understand a lot of the sociocultural processes that are structurally, that are institutionalized, and those are that are important to understand health. But most importantly, I think understanding people and youth, like you folks, it's so important because now almost we know the pandemic has generated a whole lot of stuff that everybody has experienced in, but that doesn't mean that, oh, everybody is so weak and feeble that we have to just come and save everybody. I think we need to understand what build social resilience. How do people cope, and how do they adapt, and how can we leverage on those things to engage in a transformative, to build the transformative capacities of communities. And I think youth, like you guys, are amazing group because your voices are important, and the need to even be in a society where I think most of the time people think that, oh, if parents are working hard and they get you all of this latest iPhone, the shoes and everything, you're okay. But the connection and the emotional bonding, the support, and all of those things are so important to build a healthy people and a healthy community. But we capitalism, racist capitalism, have denied many parent the privilege to even be around their children, and many youth and children the privilege to be bonded with their families and be connected. And that, affect a whole lot of different life experiences and trajectories that sometimes in the end, affect health. Look at our prison systems. I think it's something that we have to think about. I think, and so here, I think one of the things that we have to also think about is that we have to think about the fact that these institutions and organizations are not in silos, they are interconnected. Schools are connected. Like you see how the school to prison pipeline, and how that connect to the criminal system, the hospitals, the mental health and health organizations. So I think um, the youth, we also need to help build up the system where our knowledge base that some of you are getting should no longer be that silo. We need to be able to prepare them and build their capacity to think more systemic and structurally to become agent of change, not as somebody who are just I think so dependent on the structure and think in a silo ways. So those are really important kinds of the thing that we have to begin to think about, moving forward, and think more broadly, not just in our silo ways as we have been doing, because we know that doesn't really help in the midst of epidemic or pandemic.
No, you said you wanted to
And
add
I,
something to that.
Yeah, I do. I guess I would summarize if I had to do three things. Number one, and some of this was alluded by Eric, but number one, we talked about race equity. The best way to start having new conversations around race equity is actually listening and having authentic dialogue, having a participatory process where we're both engaged in, whether it's in your own healthcare, it's in your own community planning, it's around healthcare reform. We can't always think we all have all the answers. So we have to do authentic, what we call authentic community engagement and authentic listening. So that's like first. And if we don't do that, you can't get to the next two. The second is we have to think about how we care for people very differently. We always talk about healthcare, but it really should include social services. We're one whole being. We're physical, we're emotional, we're spiritual, we're economic. We have all these life moments in our life, and we have to think about it holistically and make sure it all comes together. And so oftentimes I think we have systems that are very narrowed. We care for you only, this elbow or this knee or your eyes, and we have to have it more integrated. And then and housing, and do we have a job, and we have good education, and then we got to figure out how we pay for things differently, because we're systems are in all the structural problems we're outlining are based on how we're paid, whether it's a school, whether it's a healthcare provider. We have to think differently about how we're investing in community. And so that would be my three areas. If we could start to have those conversations into the future, I think we can make a real difference.
I like it. I will say I like the top three summary method. With this, I will hand it over to my fellow council member for mid-forums. So take it away.
All right, awesome. Good afternoon. My name is Rishabh Mehta, and I'm a junior at Solon High School and a member of the Youth Forum Council. Today's Youth Forum Council features a discussion about the disparities in healthcare in Cleveland. Today's panelists are Dr. Eric Charay, an assistant professor of social work and an adjunct professor of Africana Studies at Indiana University. And our other panelist is Heather A. Stroll, the Vice President of External Staff Affairs in the Sisters of Charity Healthcare System. Our moderator is Zoe, a junior at Shaker Heights High School and a member of the Youth Forum Council. If you have any questions for any of our panelists, text them to 330-541-5794. Again, that's 330-541-5794. You can also tweet them at City Club Youth. We'll try to work them in. May we have the first question, please?
All right, so first question. This is just, again, either of you can really jump in. What are some of the ongoing changes in healthcare that make you optimistic about the future of the field? What are some things that you'd like to see change?
So I'll share what I'm very optimistic about. There have been some really great grassroots organizations that have been popping up, especially in the areas of maternal health, that provide what I call, or what we call, supportive systems. It's not about the delivery of care, but it's helping navigate the healthcare system, having a person-centered approach to healthcare, and really following individuals on their journey. Oftentimes, it means we're also having people, who have lived experience. So in the maternal health area, it's somebody who's had a child and navigated and had their own ups and downs with having the birth of their child. And the same thing, we have a medical respite facility that is trying to help homeless individuals navigate the healthcare system and stay out of the hospital. So those supportive systems, I think, are really great, because it's improving the quality of life and health outcomes. On the flip side, none of those services are reimbursed. So we need to think about how we invest in those types of programs, and see those as making a real difference long term. Because we have to get out of, acute medicine and get into really preventative and wellness.
I mean, I think, yeah, to that, I think what's some of the ongoing changes that I think I'm optimistic about, like I said earlier on, some of the statement, the acknowledgement that now a lot more organizations are saying, and that, like, NIH is now doing a lot more about structural racism, that they're thinking about, multidimensional framework in addressing health disparities and things like that, and taking on, public health approach to health, which are very good, I think, bold statement, but they are encouraging, and they show that, yeah, we can do some things. I think the issue now is with the implementation, and how they're going to be. So I think, to do that, part of some of those pieces, I think we can't really do a lot of these things without recognizing, digging deep into our history and how we are all traumatized by this history and how it shows its ugliness in every day and how we do things. And so I think um, connecting more practice to this statement and the action, the ongoing changes, I think it's something that will be important moving forward.
Awesome. All right, moving on to question 2. Do you see healthcare ever becoming more similar to systems we see in Europe or Canada in order to help more people? Again, either person. I can call on someone.
You want to go first? You want me to go first? I'm happy to,
Okay,
I think look, there are many countries in Europe who have, some very interesting models of healthcare. My husband was born and raised in Hungary, and there are some real strengths around that and some real challenges. Finland, I also know very well, and I love some of the integration of health and social services in Finland. So, are there learnings in Canada, in Europe? Absolutely. I think the question is more, do we have the political will and can we find common ground as a society to really have some thoughtful conversations around these models and find common pathways that are win-wins versus a win-lose scenario? And I think we saw that really with the Affordable Care Act. I think we were really trying to expand coverage and learn from, really, Canada has obviously national health care. How do we start to ensure all? We had a hybrid approach, not the Canadian pathway, but then we spent a decade questioning whether that was the right answer or not. So I always say, let's make reform, and then we got to continue to make reform on the reform so we evolve and we iterate together as a society to make change.
Dr. Sherrod, do you have anything to add to that?
I think that's an important issue, but it will also be something that it will require a lot more political will, and even that, beyond that, I think, look at, you have the American Medical Association. I think we know the history for quite a very long time have been so much resistance to progressive healthcare in a lot of ways. And so I think some of those areas also need to be addressed, and in acknowledging that, I think we have America. If you look at the all of the organization for economic cooperation and development countries, America spends the highest in healthcare, but we have the worst health outcomes compared to all of them. So I think, again, it comes down to, if we, since we are recognizing how capitalism and racist capitalism in particular drives a lot of these species, we once we recognize that and we're willing to make a change, I think we can do even better. And then the other thing too is that means that we need to diversify healthcare. I think in terms of, I think the perspective under which we think healthcare is, it shouldn't have to be a single model approach. And one of it that, even as we are thinking about this, is oftentimes now when laws are passed and funds are generated, then it's creating room for other more private organizations to set up. But what is happening is, instead of racial equity, we are also seeing racial outsourcing. So racial outsourcing, where corporate model that is business oriented, not equity and justice focused, are now, recruiting and setting up in communities of color, and also recruiting communities of color and attracting them. Not necessarily they want to make change, but they want to also extract, collectively extract the resources that are within those communities. So I think if we're going to be able to make some of those, we need to be able to guard around those things and resist them.
All right, I think both of you mentioned this a little bit, especially you, Heather. But the next question is, what are some of the things students can do to positively impact healthcare reform?
Well, I have an 18-year-old daughter who's a senior in high school, and so we talk a lot about advocacy. And she's a compassionate heart who has knows that she has a voice to share. And I, I always say to her, research the issues, look at both sides. I think we've gotten too polarized as a society. And I think actually, if we get all the facts together and we analyze it together, we'll find a common path together. Um, don't be afraid to speak up. Don't be afraid to ask questions, and just see your civic role. We have professional roles, we'll have personal lives, we'll also have a civic life. And I encourage students to think about their civic life and how they can give back to community, and always live what your comfort zone is in that.
Dr. Sher?
Yeah, I think definitely. I think I will say all of us should, I mean, need to be aware that our personal is political, and what is political is personal for us. And so that means that we need to be involved. We have to be civically minded. And we these days, I think we all youth have access to, you know, multiple mediums, um, the different social media platforms, TikTok, YouTube's, and all of the different kinds of the platforms that are available. I think they give youth an opportunity to amplify their voices at all times. But I think getting time to also learn, be familiar with what is happening, and be more conscious. So when you are conscious and you understand what is happening, you can then make an informed decision. But the first call, it's on the ability to recognize that you have power. You are All of us are very agentic, and if we can collectively um, mobilize our agency in using any of these platforms, I think we can make a huge difference. So this is the time that you are in, and I think it's a very an opportune time for all of you with the different platforms available. Your voices count, but invest yourself into the issues and act, as Hector said, at your comfort level, but don't be on the sideline.
Um, all right. So moving on to the next question. How have you used your platform to advance healthcare reform? Did you expect to be doing so when you began your careers? Heather, if you want to take this one first.
Well, I spent 20 years in healthcare reform and I did not expect it. So, sorry, the question made me chuckle. In 2003, I worked for a Catholic organization, the Sisters of Charity Health System, and that the president at that time was Sister Judith Ann Karam, and she asked me to partner with the team to advocate for the uninsured at that time. It was a growing problem. We were almost to 50 million. I think it was like 46, 48 million uninsured at the time. We were seeing lives lost by not having the insurance card, and we certainly saw folks who were sicker and were delaying care. And that was a journey that I'm still on today. Um, and I feel that everything I've done is about health access, because yes, you want policy reform, but you also have to walk the talk. So we have to always look as an organization, you have to look internally. Are we expanding coverage for our own people? And we worked on that, because when we looked introspectively, we realized we had some strength and we had some weaknesses that we had to walk the talk. But I never imagined when I first started Sisters of Charity that would be my path. But it's been an exciting path, and we have great accomplishments, but a lot of work to be done.
Dr. Sher?
Well, that's a good question. I think, yeah, it's some of the way that I've used my platform. Obviously, um, I do research on that, and I write papers. I share, and then with my teachings and both locally and internationally. But I think I didn't really start to think about any of these kinds of things. And I think at the time, I grew up in Ghana. I think this is where, like some of you, this is a good time to be more conscious of when I said the personal is political and the political is the personal. I didn't really have any thought initially about any of these things. And I was also educated more to, I mean, within a colonial lens, and to think that colonialism was a benefit to me, and some of these injustices are actually good until, I write my way into having my master's and then a PhD. That's when a lot of these things, became clear to me that these are all social injustice issues that need to be tackled. And so, for me, it came not as early as some of you are doing now, because at your age, I wasn't involved in things like this, and so I think that's why I'm sharing some of these lessons. But I think now I'm seeing it that it's so connected to everything in life that we do. And so if something is a human right or something is a right, I think it's not somebody that has to give that to us. It's something that all that society needs to do is not to limit us to enjoy what is rightfully ours. It help is not somebody who created it. So nobody could create it. But what we are seeing is that we are living in a society where actions of systems and in communities and staff organizations are actually putting so much strain on our ability to access and enjoy that which is our right. And that it's something that I think we have to talk about. We are not asking people to give us help. We are asking systems and others to take off the restrictions and the roadblocks that they have placed on our way to enjoy and experience that which we are made to have. So that's not something that's like a big demand.
Mhm. I think going off of this, and this is also a very personal question for me. I mean, before this conversation, I can say the extent of what I knew about healthcare is that at 26, you got to figure something else out. You both kind of touched on education as being a key factor for how we kind of get at the root of this problem. What would you say specifically, like for someone like me who's a junior in high school, how does one become more educated about these issues and also just kind of just the broader picture of healthcare in general, I suppose? Dr. Sher, if you want to take this one first, if we're switching
I
out.
I think you can start just by being observant, even in what is around you, in your immediate surrounding. Just take a more critical look at how things are organized, and how those organizations, what are some of the processes, the norms, and things that flow through the structures. Like even in your school, just pay attention to how are even your classrooms organized, whose voice count, whose voice doesn't count, just by even the mere design of just the classroom, I mean, environment. And what do those things mean? Then you look at some of those pieces, how do they factor into family connections? And because when you're thinking about, when you see somebody beside you, sometimes I think one thing that we are made to think that, oh, we're just individual, but nobody is on their own. Nobody's an island, because I am a part of a family, a larger system, a community. So if I am sitting down there, I am bringing in pieces of the communities that I am part of, the family that I am part of. So once you observe me, you see me, it gives you glimpses of things that are affecting the bigger pie that I am a part of. So by those mere observation, it can help to see things that are happening, and that can make me to ask questions, about, okay, what happens at where you live, what happens at where you are, or tell me more about yourself. And when you begin to pay attention to people as they say their narratives, and you're listening to those narratives, not to judge them. You learn about how processes and the structure that they are involved and their interaction with those structures and how that is shaping their life. And that provides you a window of opportunity to begin to think more critically and think about taking actions.
So I would answer. I made a list of four. First of all, know yourself and know your own health, and that's really critical. Understanding your nutrition, your lifestyle, healthy eating, active living is really critical. And the more you understand your own health, and that includes, by the way, your own mental health, your own physical health, the better, because then that helps you. Once you understand yourself, you can understand others. I would also just be inquisitive with your doctor, if you have a primary care doctor, or if you have any other clinicians, if you have a therapist, ask them their insights into health and health and wellness, and how we can make our world a better place. Thirdly, I would definitely, I always encourage folks to look at original sources. Go to, there is Healthy Neo, which is a website around our community's health. It's just a data collection source that really tries to pull data from different sources to help us understand our community health needs, really. But it has a lot of great information. But if you're hearing about something that you care about, mental health, behavioral health, eating disorders, find sources that are really original sources that are doing the research frontline to understand those issues. That is not to say there's not there are some tremendous resources here in Cuyahoga County, and I would be remiss not to give a shout out to the Center for Community Solutions, who does really a tremendous job in developing a nonpartisan. They research and put out information in a nonpartisan manner about critical issues that we all care about. And so finding nonpartisan, neutral sources is really important.
So I will say, I believe this is a similar question to one we had earlier. But when you first began your research / your career, did you expect to end up in the position you were in? Were you, I think what this question is trying to ask is, like, did you anticipate being a teacher, or did you always know you wanted to work in an advocacy kind of position?
I think some of them evolved with time. Like I said, even for me, I didn't. I knew I wanted to do something around children and families. I mean, that was something that I had thought of in creating supportive context for families to thrive, because I know families act like a more comprehensive welfare system if they are supported, but they also need support. So that was how I kind of saw it. And then the more I went into that, then I realized that, oh, the families are also nested in context. So when I study parenting, a good parenting or competent parenting practices are dependent on the contexts and the affordances that those contexts allow them to have. So then that was where I began to see that, wow. So then, and those contexts are not just something that just happened, they are man-made contexts that we all inhabit. And so that was when some of these things began to click in for me. I remember, I think in my when I one time I was at a school, and the principal had called me for one of my kids. This was actually, I was in the foster care, and then said, oh, this child is having an issue, so come and take the child out, because as a foster manager, that was my role. But that made me felt how parents feel. So I asked the person. Initially she didn't say she was a principal, but then I said, so what have you done about this issue that you're telling me about this child that you're asking me to come and pick her? She said, do you know who is talking to you? I'm the principal. She mentioned her name. And I said, wow, I'm glad you called. And I said, well, I know America does not subscribe to the Convention on the Right of the Child, but education is a child right. That's why in this country, there's a compulsory law for children to be in school. So, and I, by the way, my understanding is that you and the family are partners, and the outcome of that partnership is this child's development. So now that you are calling me or you are calling the parent to come and pick the child, what is your role in this child's development? And she was quiet on the phone. You know, she, after that, she never asked me to come and pick the kid. She, anytime there's something, she'll call me. Then she'll ask me, what do you think we should do? You know, so that also helped me. And I began to know, see that if you also know what you're doing, I think it helps you. You know, like they say, knowledge is power. I think it's important. That's why all of us, all of you investing in what you do so that when you are confronted, you are, when you know, people know you know the truth and you know what is there, it's, they know they can just bully you just like that. And so that provided me a very good, I think, window to see that, wow, I think I need to really up my game so that I'll be able to be effective in these kinds of work. So those things evolved, but the more it got on, then I found that actually I felt the passion, the joy when I see things are done the way that they up to done, they help family. So that's how, it has been evolving.
Heather, do you want to share your story with our last minute or
Sure.
so?
I had no idea where I'd be in this seat when I first started my career. But I will share a story that I like the storytelling that you did, Eric. That when I was just graduating from college, I met an alum who was this amazing woman. She'd done all this work in the nonprofit space, had helped on the AIDS quilt, and just did tremendous work. So I remember asking her kind of a similar question, and she said, "Heather, my life was like all these patches and making a quilt." And she said, "Now I look back and I have a beautiful quilt, but I had no idea that I would have that quilt." And she said, "My only encouragement to you is when a door opens, you take it, you walk through it, you embrace opportunities, be confident. You'll figure it out. You're a smart person. Just when those doors open, walk through it and you'll have that great patchwork." So the sky is the limit for you all. And I hope you achieve it.
I think that is a beautiful note to end our forum on. And with that, I will pass it on to Ellie for our closer. Take it away.
Good afternoon. My name is Eleanor Ramos. I'm a junior at Riverside High School and a graduate of Lakeland Community College. I'm the current vice president of the Youth Forum Council. Today, we have enjoyed a youth forum panel discussing reform and disparities in healthcare. I would like to thank our panelists, Dr. Eric Kayer, who has a PhD from Indiana University, and Heather A. Shaw, who is the vice president of External Staff Affairs for the Sisters of Charity Health System. Our moderator today was Youth Forum Council member Zoe Ellenbogen. Today's forum was sponsored by AT&T. Thank you for your support. City Club Youth Forums also receive additional support from the Doris C. Malcheski Trust, Bank of America, PNC, Northeast Ohio Regional Sewer District, and OEI. We thank you for your additional ongoing support. Join us on May 12th for our next youth forum on the Stop the Hate essay contest. This forum is now adjourned.